you get many causes. So depending on which the person gets, whether you get over functioning of your thyroid gland, hyperthyroidism, you get in own symptoms, or your thyroid gland not dey produce enough of the hormone, hypothyroidism, e also get im own symptoms. So depending on wetin dey cause am, the doctor go come check you and say, okay, this is what and what we can do for you. They can also decide to give you medication, and in certain cases, your doctor can also decide to do surgery to remove that swelling because e no dey okay for the face. But depending whether you get hyperthyroidism or hypothyroidism, they will come talk how to help you manage am. Dr. Israel, you want to add anything to that?
No.
Okay. Um, what is the best medicine for family planning? The type wey no go make person fat.
I think we don't answer this question. As I earlier said,
Yeah.
we cannot give you anything. Just go and meet your doctor, or you see good for a family planning clinic.
Okay. Blessing. Wetin you dey ask us here? You want us to tell you to take this family planning. And then when we tell you to take this family planning, and then along the line, if you come add weight, you go talk say we don't tell you rubbish. When you go to the family planning clinic, they go tell you the different types of family planning and their different side effects. Whether na the pills you wan take, whether na the injectables you wan take, whether na the implant you wan take, whether na the IUCD you wan take, they go tell you all of them. They go also check your body, find out if you get any medical condition, any medical history, or any family history wey go affect you from using this one and taking this one. That is why we no dey tell person this is the best. Every human being body and the one wey the patient also decide say after all the information wey they don give me, this one na I feel say dey okay for me. Those This kind answers dey put women for problem on social media because there's nothing like the best. Hmm? You understand? One of my leg is swollen. Please, what can I do? Dr. Israel.
One of your leg is swollen. So the leg they pain you, and you hit the leg for somewhere. Um, okay, these are some of the few questions. You injure the leg. These are some few questions when that need there to be answered. And you don't need to give me the answer, because even though you give me the answer, I not go fit continue anything for you for here. So these questions, I just only want to let you know that it's not just your leg they pain you be the main thing. The main thing are other questions that follows. That's why you go to go hospital, and the doctor now go tell you every other thing and the drug or whatever you need to be doing. So what can you do that I'm telling you is go hospital. So that when you get to the hospital, they go look the leg. If not the one where they want to do any ultrasound and Doppler scan for, they go do one. If not the one where they say, oh, nothing too bad, we just give you some medication, they go give you. If not the one where they'll tell you, say, oh, get what you need to do wear, they go tell you. Now, waiting they see, based on waiting they see, then they go fit tell you what to do for that leg. And make it good. As you ask us what you want make you do, now we they tell you what to do now. Now for you to go hospital so that you will get the best treatment.
Thank you, Dr. Israel. If you just dey come, you dey welcome. Um, no forget to share the live because a lot of people know they share this live. The only thing wey dem care about now to ask question and disappear. And that kind thing, no good. We know they support our own on online unless now people wey dey do things. But this kind of stuff support by sharing the live session. My blood is going high despite my blood pressure medication. Okay, my blood pressure is going high despite my blood pressure medicine. What can I do? Thank you. Okay,
Okay.
okay,
All right,
Dr.
that's
Israel, go
fine.
ahead. Go ahead.
Okay, if you notice that your blood pressure they go high, even though you dey take drug, one of the question are to first of all find out how do you take your drug. You dey take am every day or you dey take am only when you go check your blood pressure. You can't notice say e high na that time you dey take am. Because some people they do am like that. They go take am today, they no take am for 1 week. They can't go check their blood pressure, e high, they can't take am again. So if you dey do am like that, it means that you are not treating yourself. Your blood pressure will always be high because blood pressure medication are every day that they take am, unless your doctor tell you otherwise. But most of the time, most people not the wait me doctor tell them otherwise. Now then they tell themselves otherwise. So that na one case. Another case now, sometimes the medication one that they give you feel not they work for your body as it's supposed be. So if you don't notice that your blood pressure they go up, even when you dey take medication, you also need to go back to the doctor when give you this medication and let her know say see what they happen. So they go come know whether not to add drug to the one that they give you or whether not to remove that medication and come give you another medication. Then three, they go also want find out why is this blood pressure they go high. So some case fit be say not be even the not be because of the medication. If it be say other things they when they trouble you, when they make your BP they go high despite those medications. So if those things are taken care of, if they don't fit take care of those things, your BP fit come down on its own. And with the help of also the medication, it will come down very well. So these are the three things when we really need to look at, so that maybe for know which of them be the problem. So for that, you'll be able to address the problem very well.
Thank you, Dr. Israel. Thank you very much. My man has prostate enlargement. Can he still get pregnant?
Can you still waiting?
Can he still get me pregnant?
Okay, Dr. Fred, answer now.
Okay. There are different types of prostate enlargements. If you are certain, no be say you just go lab, go do scan, and scan showed that you have prostate enlargement. First of all, wetin we dey call am na benign BPH, benign prostatic hyperplasia or hypertrophy. E no go affect the man from impregnating a woman. However, if the prostate is enlarged, it needs to be managed because it will give the man other symptoms. Do you understand? But say it go affect his fertility. No, BPH no go affect a man fertility. But it go give the man problem, trouble. Wey be say the man sef no go come dey one day think of pregnant because the symptom wey dey worry am go even cover him and thinking of that. However, no be say e go affect am to fit give woman belle o. He will still have his sperm and the sperm will be functioning and the rest. But e go dey affect the man wey be say to even come dey think of doing that do the do, im mind no go dey there because of the symptoms wey the thing go give am. You understand? Majorly. Good evening, everybody. Welcome. Before I continue, let me tell you about the fruit challenge. We are starting on the 1st of February 2024 to the last day of February. The reason why I'm saying this is because somebody has reached out to me and said, I will send you money to also support the fruit challenge. One of the follower here, the person is watching right now, saying will send me money as part of the prize. So if you dey here, you want to sponsor the fruit challenge, or you have a brand, you want to promote your brand using this avenue, you can sponsor the challenge. Send me an email and we'll take it all from there. The fruit challenge, every day you eat your fruits, you eat your normal food. We do it for 1 whole month. Why are we doing the fruit challenge? To encourage people to eat fruits. The more you eat fruits, it helps your digestion, it helps you a whole lot. I'm trying to raise people who will eat more fruits and stop eating junks. This is the reason why we are doing it. And this is the 3rd year doing the fruit challenge. I just say make I put on here. Thank you. So start getting set. Doctor, good evening. What could cause a 16-year-old from going to toilet a week ever since he's 5 years old? I don't understand this question. Dr. Israel, I don't know if you understand the question. The child is 16 years. The child cannot go to toilet for a week now. And then what is the relationship with ever since he's 5 years old? I don't understand. Dr. Israel.
My what was, is it that he's going to toilet once every week, or what he tried to talk? I believe that ever since he's 5 years old means, say, since he be 5 years old, now they get the, now they do like that. But is it that he's going to toilet once every week or what? I beg. John Ben, please help us clarify your question.
I have injury on my joint leg before, but now it's causing swelling. I don't know why. Please talk to help me. Hmm.
You have injury on your joint, on your joint. So which of the joints? Is it the knee joint? Is it the ankle joint? So which of the joints? Or the hip? So which of the joints? If it's causing swelling, it may be that it's inflamed. Those are signs of inflammation, swelling, pain, difference in the when you touch the place. It could, you feel the hot pass every other part. That's, and go the red. Those are signs of inflammation. So it means that the place is inflamed. And if it's inflamed, it means, say, some process they go on for that place when the body not really like, and I make that place they be like that. So if you don't think when you injure the leg, the joint, I consider it be like that, it means, say, maybe you go see orthopedic doctors, doctors where they specialize for bone, so that they may want to do X-ray for that leg and see what is inside the leg and know what and what to do for you, so that the pain, I know say go dey painful, so that the pain will they reduce and you'll be able to walk and do whatever you want to do with that leg again. Dr. Fred.
Yeah, thank you. If you just dey come, you dey welcome. This program's now every Sunday by 8 p.m. Nigerian time. So if you come late, I'm sorry. We have so many questions here. We're trying to take them one after the other. Why dry mouth? Okay, we have a question here. You say, why dry mouth and tongue while the blood sugar is normal?
You have dry mouth and tongue, it means, say, you know, they take a lot of fluid. You need to take a lot of fluid. That is if your sugar they normal, and you check and they normal, you notice say your sugar is normal, and your dry, you they still they get dry mouth and tongue, it means that you need to take a lot of fluid. Apart from that, there might be other condition when we give you that kind of dry mouth. But first thing first is to take a lot of fluid. You see, Dr. Fred said they take fluid, and if they talk too much, you go get dry mouth and dry tongue. So take a lot of fluid. I think that would be the first thing to help you to reduce those things. And if you also notice, say, this period now, everywhere they dry this period. So most people will be having that dry mouth and dry tongue, dryness like that. So because of that, we need to take a lot of fluid this period.
Thank you. Doctor, what is the cause of a child of 8 years experiencing swelling at the backside of the ear, the neck, and around the P area? It was small in size when we noticed it. Now it's becoming big. What can you have advice we do?
My advice now, carry that pikin go hospital as soon as possible. Carry that pikin go hospital as soon as possible. So many things can be doing that child as at that time. Now, but I don't want to come and be. May I not come scare you, or may I not come say anything. May you come the fear small. So I don't want to do that. But I will just advise, say make you carry that pikin go hospital. And who do they go see? Go see pediatrician. Doctors wey dey specialize for children. So when you see them, they will check those swelling and know what kind of swelling they be, whether they benign or they malignant. When I mean benign, I mean say not be cancer. When I say malignant, it means cancer. So I made a see. And sometimes it can be the lymph nodes that are enlarged. So if the lymph node is enlarged, why are they enlarged? So they also want to find that. So, but the
Yeah.
best thing is for you to take that picking, go hospital as soon as possible. ASAP.
Thank you so much, Dr. Israel. The best advice you have gotten is take the child to the hospital ASAP. Hmm? That is it. I beg. As soon as possible. Good evening, doctor. Please, around September, I have a rat bite on my leg because I wanted to kill it with my leg, and I only took tetanus injection. Since then, I have been thinking about the Lassa fever they are talking about. Please help out.
Okay, I don't need you need to be. I'm not sure. Say you so you go. You need to the fear. If you get Lassa fever by now, things could all dey happen to you. So don't worry yourself. It's very nice that you took tetanus injection. If like say you tell me say you never do anything, then I may be forced to say you not do well. But as far you've taken tetanus injection, I think you have done the best you can. So
Yeah.
don't worry yourself. Lassa fever not you're the cash person like that. And from September till now, you never get any symptom, you never get anything. You just need to calm down. Continue your normal activities. Eat a lot of vegetable, take a lot of fruits, drink plenty water, and try to keep your environment neat, clean. I think you are good to go.
Yes. No need to panic. You know, get Lassa fever. No need to panic. Okay. Good evening. Somebody is watching us from China. Bisong Ake. Yeah. How is China? How are you? Everybody, wherever you are watching us, just put in the comment section. Let's see if we can give you a few shout outs. Tell us your location. What can I use to stop ingrown hair? Hmm.
I did not get your question. Your voice was breaking.
Okay, what can I use to stop ingrown hair?
Okay, Dr. Fred, I think you should answer that because
Okay,
I don't think I have anything to say.
this question, this question is not even complete. We don't understand what you mean by where it get ingrown hair. So our mind is open. Your question is not complete. Where they get ingrown hair. By the way, we cannot prescribe any medicine for you. We don't prescribe medicine on social media. We know they give medicines on this platform. We know they do and we know they share medicines. We dey always advise you. If now something we will say, okay, may you stop to do or explain. And if we know, say you need treatment, we will tell you may you go hospital. So your question is not clear. What is the cause of pain at the back of the neck? Anything can actually cause you pain at the back of the neck. Number one very common reason why you might have pain at the back of your neck is when you have poor posture. You know, we're in a generation where everybody is with their phone right now. I'm talking with you. I'm trying to relax and lean back so that I don't bend my neck. If I do this for a long time, I can have back pain. If you work in an official environment where you sit down with a laptop and you have poor ergonomic positioning, you can have neck pain. If you have poor bed, your bed is not properly aligned and your pillow, you can have neck pain. You understand? Maybe when you sleep. Or trauma, you turn your body somehow. So there are different things that can actually cause you neck pain. You can also have degeneration of the spine. So your spine, because of your age, the spine, your cervical spine, cervical spine, if you get problem, if it degenerate, meaning say the bone if you can't they change from normal. So many factors fit cause am. Age, the work you do. So we just give you a rough idea of wetin fit cause neck pain. My own final advice to you now, if the neck pain just start few days ago, rest the neck, take analgesic, maybe e go disappear. But if the pain don dey do you for a long time, then you have to go and see your doctor. The reason why me dey tell you say if e start few days ago, because it can happen to anybody. You feel sleep with a wrong position and wake up the following morning and you dey get neck pain. You don't have to see a doctor for that. Just rest, take your stuff, you go. But if you know say the pain don dey do you don tey, ah, please try to go to the hospital. Hmm? Try to go to the hospital. Okay, before I continue, I noticed something. Let me say this. Me and Dr. Israel and some other doctors, we they come online, we they teach like this, they answer questions. Few people, very few, they encourage us. How? By sharing the video or by sending stars, you understand? Or by joining membership. The reason why I'm saying this is not that tomorrow, if you can't see doctor tell you say may you pay for consultation, I say may you pay for private consultation, you go dey vex. A lot of people don't like to dey encourage people like this, but this person here, this person just sent some Clara, thank you so much. I just wanted to appreciate you for this £5 you send, because this live session too, I they pay money, we they pay money so that we fit have this live session like this. So thank you everybody, and thank you specifically to you, Clara. You did that last week and you're doing this again today. Thank you very, very much. I appreciate you. Okay. Let's go back to the questions. We have so many questions here. My God, so many questions. I'm trying to go up. No vex. Oh my God. The questions are much. I'm sorry. Okay. Doctor, what can cause a woman to be having blood drops from her like period for months?
Okay. So one of the things, if not be period, before I even talk some things, make I just tell you, say you go need to go see a gynecologist, doctor where they specialize in women, and so that they go evaluate you very well. That's a very good thing to tell you first. So some if you are on some kind of medications and some pills, you can be having blood like this. You can just be having blood like this for some people, and it dey happen. Sometimes they get what they call I don't forget the name. That is, we cannot explain why this blood they come, and we don't check, we don't ask you all the questions. We not see
DUB? Is it DUB?
yes, we not see
Dysfunctional
any
uterine bleeding.
yes, we not see any reason why that blood they come. So it can still be causing you to bleed like this. So if you can't get some what we call endometriosis, for endometriosis now is they see the uterine the inside of the uterus for other part of the distance, other part of the uterus, if it cause bleeding like this, and that one still they go with a lot of severe pain. So for people where they get that, if they say the fibroid fixing make you bleed, fixing make you bleed like this. So when you don't notice all these many things, and you notice this bleeding always and always and always, and you know they stop. I think it's for you to go and see your doctor, so that make the do scan for you, check your uterus, check everything we concern that area. If you still get injury, for all those places, if you see the lead to bleeding like this, so check all those areas, check everything, and then they go know what to do for you, so that make those bleeding for stop.
Thank you, Dr. Israel. We get like 10 minutes more. 10 minutes more. Please, I wake up in the morning. I come see, say, my mouth and face swell up. Waiting be the cause.
Okay, mate, a few things physically cause that. One, allergy. You can be allergic to some things when you go carry yourself deep within the period, within the night. So when it happen, your face, your mouth, all those kind of things their face swell up like that. Mostly allergy, mostly something you ate, or either something you ate or something you went close to. Another thing, if it be like say insect bites you. So all these things when I mentioned, they're all allergy. So when you have allergy, you can have this. So if they get your eye is swell most in the morning, and people they notice are always. You also want to check your kidney, whether you know they get issue with your kidney, you never can tell. So if this thing are the first time when they do you, or it don't they do you before, I think you go need to go see your doctor. And if na allergy, you really need to know what you are allergic to, so that you go run away from that thing, because that's the only cure to that. But if not that, if it's insect bite, you need to know what kind of insect, and you know what and what to do for all of them.
Thank you, Dr. Israel. My knee and my legs hurts. I don't know if it's because of my weight.
I don't know your weight, so I cannot tell if it's because of your weight. But if somebody they very fat, it can lead to die, or it can lead to this kind of pain. Eh? Also depend on your age as well. If you are getting to your you don't reach those people when you don't reach menopause, or you don't near them finish, you should see they get this kind of pain small small, they hurt you, or they hurt some kind, and all that. So if you see injure them before, you can also be having pain in that region. So if you they think, say, maybe my weight, why not work on your weight? And if you work on your weight and it reduce, yes, you are winning. And so just for you to say, if you dey fat, your weight can actually cause it. Dr. Fred,
How? Sorry, I beg. I don't know if they hear me. Victoria from Holland, Sandra from Nigeria, Paul from Spain. I see you, Paul. Winners, I see you. Amy Blessing, I see you from the UK. So many questions, and our time is almost up tonight. Oh my God. Let's try to be very, very fast because of time. Oh my God. Okay. I practically check my blood pressure every day. I don't take it every day. So you don't take your antihypertensives every day. I discovered that if I take my blood pressure medicine every day without checking, it might get low and make me weak. So I had to stop taking it every day. Is it wrong?
okay. Uh, my answer to you is that who's tell you make you stop taking it every day? If now your doctor, no problem. But if now you decide to stop it every day, to stop taking your drug every day, you are wrong. You are wrong. Now your doctor now will tell you. So if you notice, say, anytime you take the medication, they make your BP they low, and they go they weak, go back to the hospital. The highest way the doctor go do, if now two drugs he give you before and the milligram where he give you, he go reduce them. Either he reduce them to just one drug and reduce the milligram, so you go continue to dey take am every day and nothing go they do you, or he go tell you, make you not dey take am every day, but you dey take an alternate day. And another thing is that, when do you normally check your BP? Is it that before you take your drug, or after you take your drug? Because some persons, when you take your after you take your drug and you check your BP, yes, it's going to be it, because the drug they work, it go look. But if you dey check your BP before you take your drug, sometimes it go look like say e high. So it now depend on when do you check your BP. Two, who tell you make you stop, make you not dey take am every day. If now you tell yourself you are wrong, so you need to go to the hospital, so that your doctor can actually do the adjustment for you. You can get where you go do and reach, even those you dey by yourself, they take am when your mind tell you, when you check and say e high. You get where you go reach, even that time when you think say now you take dey take am, e no go work for you like that. So it is better you meet your
Okay,
doctor,
thank you.
make it
Yeah,
one to help you, arrange am for you.
thank you. So many questions here, and our time is almost up. My son goes to toilet once a week. He's 13. What could be the problem? Your son is 13. He goes to toilet once a week. Once a week is not okay. So we don't know how long this has been happening to your son. So we are not 100% certain on what is going on with your son. You understand? We are not certain. But going to toilet once a week is not okay. We don't even know how long this has been happening to your son. The general advice: increase your son's fruits, fiber, vegetable, and water. If you have done all this and yet he still goes to toilet once a week, let a medical professional check him. It's not okay to actually go to the toilet once a week. It has to be like once in like 2 or 3 days, no problem. But once a week is not, I don't think it's okay. So increase his fruits, increase his vegetable, increase water intake, and see if it will improve. If it doesn't, let a doctor check your son. Once a week is quite long. It's not okay. I don't know if Dr. Israel shares same thought with me.
Okay, as Dr. Fred talk, you need to once a week is it's not really cool. So it depends on what your pikin still dey eat though. If you basing on food when they eat when they very we go make this food they very strong, it go dey very difficult for am to dey go toilet every day. And if the pikin don dey notice pain when going to toilet, it go dey fear to dey go toilet. So once e dey fear to dey go toilet, e no go wan go toilet. So I think you go need to take a lot of water, a lot of fruits, a lot of vegetable, to see if that one will help. But if that one not help, I bet make it go hospital. They need to check am. They need to see why it always be like that. And please try check the food when they eat. Yes, try check the food when they eat. If the food and waiting go feel make sure say make it stew strong, that can also actually cause that.
We have so many questions here, and our time on this live session is up. Oh God, I beg. Doctor, please, is hypertensive heart disease treatable?
Hypertensive heart disease is the same thing as hypertension. When you don't get hypertension, it can cause problem to the heart. And can they make the heart they get like heart failure? Yes, if you continue to take your drug very well, your heart will be normal, will go to that normal state where they work very well as it used to be. But it means say you must be on your medication. When you say treatable, yes, it's treatable, but it's not. You may know one thing. Treatable is different from curable. And when we talk about cure and treatable, it's two different things. So treatable, yes, it is treatable. Dynamic attention and hypertension. So when you are taking your drug very well, you will see you can do everything what you want to, and nothing will happen to you.
My neighbor's wife here asked me to ask you, my neighbor, okay, that his wife has stopped menstruating after Jadel implants. What could be the cause, please?
Okay, that one an implant, and that's one of the things when family planning can actually do. So family planning can actually stop for some persons, not everybody. It can actually stop them from seeing their menses. And it's not bad. There's nothing bad in that. I know say the man don't they think say now bad blood, now not going to come up for the body. So menses is not bad blood. There's nothing like bad blood. Say if they see your menses, it means say they lose bad blood. What of those when don't enter menopause? Does it mean say that they gather the bad blood? Or young girls when never started to see menses? Does it mean that they gather the bad blood? So no, it is not a problem. It's just that the implants don't stop, don't make the body feel say it get belle. So you don't make your body feel say it get belle. Now make in order to see immense. So not be problem.
Thank you. Oh my God, Dr. Israel, time is almost up. We have like 1 minute to the time, and we have so many questions. What do we do?
Let's just answer the one we can, and when our time is up, we'll tell them bye bye.
For a week, it's always difficult for him to go to toilet since he was 5 years old and he's 16 years now.
Okay, just as we have said, I think we've answered this question based on what the first person talk. The first question, something it's almost similar like this. Take your child to the hospital.
Dr. Fredosa, I made my zobo with pineapple, ginger, cloves, and honey. Hope I'm on a good lane with it. Yes. I really want to stop soda intake. Yes, you're on a good lane. Zobo with pineapple, ginger, cloves, honey. Honey, okay, that's nice. You're on a good lane. Stopping soda intake, I'm encouraged. I'm happy you want to do that. And also, the fruit intake would also help you next month. These are stuff that would help you live a healthy life. Yes, you're on the right track. Let's see. Let's select your question. Antonia, I see you. Um, okay, let's see. I'm trying to take more questions. I'm going down. Uh, okay, some questions that we have taken before. Doctor, please, doctor, talk about BMI so people will know their weight level. I have made a video on BMI before. It's online. Hmm? I made a video on BMI. We can't really talk about BMI here. That it has to be a special class. So for Israel, can we do a special class on that? We've also had a live session about weight. We've had the live session about weight, meaning someone can't talk to you in private. No, Kelvin, no, I don't talk to people in private. I know they do them on social media. In private, you want to take my private time. I can't give you my private time unless you want to pay for my private time. Sure, I will make out time for you. But saying that I will just be talking to people privately because no, we don't do that. We are very, very conscious of our private time, and that is our most valued asset. So we can't give it to people because that is why we make our time for you like this. We come online and we answer you. But privately, you will have to book for consultation and you will pay for that consultation. And then you will have our private time. You understand? But say we could just go follow you chat randomly private. And sorry, no vex. We know they do 'em. Yeah. Well done. Thank you, everybody. We are done. So, Israel, any final words?
Okay. What I go advise is that I beg, make we try to dey believe our doctors more than our neighbors and wetin dem say. I hear say dem say, I hear say dem say, na dey lead people to so many problems. Believe your doctors more than anything anybody say. Whether the person don fit pass through the problem or not, it may not be giving you the correct answer to whatever you are asking. I get one scenario where person they ask me, say he do scan, say when he go do ultrasound. I was shocked. Like, are you serious right now? What's the difference between scan and ultrasound? And then say now if you want to fall into that into that shit. And if like say na some hospital now you go, now to your collecting money free of charge. So please, they believe your doctors more than wetin dem say, na so dem say, na so dem say, e no dey help. Now also if you dey stay Nigeria, you will notice say the weather don change again and everywhere is dried, it's winding and all that. E be like say harmattan come back small. Abeg, e good make we dey take a lot of fluids this period and make we try to keep ourselves safe from every form of or any form of allergic reaction or diseases. And lastly, before I come out, I want to use this opportunity to say, you guys, thank you. You have been a wonderful person to us. If not before you, we for not day here today. So thank you for always joining us and for this life when we did do. Thank you, thank you, thank you.
Thank you so much, Dr. Israel. And if your doctor tell you something and your mind, you know, carry him, you know, believe him, no problem. Please, you are within your right to go and see another doctor. I know we know say some people sometimes they know they trust doctor. They say doctor wicked, this and this, no problem. But if your doctor follow you talk and your mind no carry him, or you no believe, or then tell you say bless it, they won't chop you. Okay, no problem. Please, you are within your right to go and see another doctor. No be say you go enter the streets. People go dey give you. Most people don't lose their life because of them say, them say, them say. I beg. And then most importantly, again, for we country, make we dey careful of those people where they do test for road. They will carry machine, tell you say this machine go check whether you get cholesterol, whether you get thyroid, whether you get this and that and that. Those people are actually out there to chop you. Make you dey careful. I beg. I beg, I dey beg you because they cause a lot of problem. They make our people they fear. So look out for them and run away from them. If you get any problem, we dey always beg you, please see your doctor. We are not here to look for patients or to chop you or to lie to you so that you will like us. We are actually trying to see if we can do our own little part to help humanity. That is why we are here. Once again, thank you for supporting us. Thank you for sharing. Thank you for liking. Thank you for sending stars. Thank you for sending super stickers, super chats. God bless you all. This program now every Sunday, 8 p.m. to 9 p.m. Nigerian time. We don't dey do am for like 4 years now. Every Sunday, 4 years. So God has been helping us. So I beg, no come late. So that next time when we start, you no go miss out. Thank you. Remember, good life now waiting. Good life. Oh yeah, everybody, good life now waiting. Good life
So
now sense. Now sense. Now sense. Take care, everybody. Bye bye. Dr. Israel, you too much.